Assalamualaikum and a very good morning to everyone. We are from LAB10. We'll be presenting on the effects of caffeine consumption on blood pressure among second year UKM medical students. These are the list of our group members. As for the introduction, hypertension is defined as systolic blood pressure of 140 mm mercury or more, diastolic blood pressure of 19 mm mercury or previously undergoing antihypertensive medication. Caffeine is defined as a stimulant compound that is found naturally in coffee, tea, cocoa, and cola nuts, and it is also added to soft drinks, foods, and medicines. And this is the blood pressure table that is defined by the American Heart Association. For the problem statement, caffeine consumption is often related with the risk of hypertension as it can cause change in blood pressure of a person. A study by Myers in 1988 concluded that individuals who do not regularly ingest caffeine may experience increase in blood pressure when drinking coffee. The question is to clarify whether the amount of caffeine consumption can affect the blood pressure of an individual in association with gender, race, caffeine status, and frequency of caffeine consumption. For the research justification, caffeine increases alertness, reduces fatigue, and improves performances on tasks that involve long-lasting response when the alertness has been reduced. Caffeine can cause side effects such as headache, stress, fatigue, depression, and anxiety. Caffeine consumption is often related with the risk of hypertension as it can cause changes in blood pressure of a person. Therefore, the research will be focusing on the relation of hypertension status to the frequency of caffeine intake among participants. For the research questions, first, does the amount of caffeine consumption can affect the blood pressure of an individual? Second, what is the difference in the amount of caffeine consumption between male and female? Third, what is the difference in the effects of caffeine intake between male and female? Research objectives. The general objective is to determine the association between caffeine intake and blood pressure among second-year medical students in UKM. For the specific objectives, first, to investigate hypertension status among second-year UKM medical students. Second, to investigate the frequency of caffeine intake among second-year UKM medical students. Third, to investigate the correlation between caffeine consumption and the hypertension status among second-year UKM medical students. And the last one, to determine the difference between the caffeine consumption and hypertension status between male and female students. For the research hypothesis, first, students who consume caffeine as their daily habit has high blood pressure. Second, there is high intake of caffeine, especially in the form of coffee, among second-year UKM medical students. Third, the consumption of caffeine increases blood pressure among second-year UKM medical students. Fourth, male students have higher consumption of caffeine and hypertension status compared to female students. As for the conceptual framework, we included 4 factors that may affect the individual's hypertension status. The 4 factors are social demographic, behavioral factors, environment, and the pattern of coffee intake. For methodology, the study design that we use is cross-sectional study via purposive sampling. Our participants are from second-year UKM medical students, and the number of respondents for our research was 148 students. Those who are previously diagnosed with pre-hypertension was excluded from this research. The study tool that we used was questionnaire, which was distributed using Google Forms. We used automatic sphygmomanometer to measure the blood pressure. Our independent variable consists of gender, ethnicity, caffeine consumption, and frequency of caffeine consumption. Meanwhile, the dependent variable is the status of hypertension among our participants, whether it is a normal or hypertension status. As I mentioned before, we use questionnaire and the measurement of blood pressure to collect data. The data that we gained was analyzed by using IBM SPSS version 21. Then, Pearson chi-square correlation coefficient are used to determine the relationship between the variables. Now we have come to the results and discussion section. We have a total of 148 respondents, which consisted of 42 males and 106 female students. The majority of our participants are Malay students. Next is the caffeine consumption status, where 89% of our subjects consume caffeine. For the frequency of caffeine consumptions, most of the respondents consume caffeine once a week. Next is the hypertension status among the respondents. Thankfully, 89.2% of our respondents have normal blood pressure. This pie chart shows that 89% of the respondents have normal blood pressure. Bivariate results. Based on Pearson chi-square, the p-value for association between gender and hypertension status among medical students is 0.00, which is less than 0.05. Thus, there is statistically significant association. The p-value for the association between ethnicity and hypertension status is 0.291, which is greater than 0.05. Thus, there is no significant association. The null hypothesis is not rejected. The p-value for the association between caffeine consumption and hypertension status is 0.534, which is greater than 0.05. Thus, there is no significant association. The null hypothesis is not rejected. There is no significant association between the frequency of caffeine consumption and hypertension status. The null hypothesis is not rejected. Conclusion: there is no significant association between caffeine consumption status and hypertension status among medical students. There is no significant association between ethnicity and hypertension status among medical students. There is no significant association between frequency of caffeine consumption and hypertension status among medical students. There is statistically significant association between gender, male or female, and hypertension status among medical students. Limitations of study. Limited population of participants in our research project. Same ages for every respondent. Unequal distribution of gender among medical students. Recommendations: conduct study with bigger sample size. Various of ages included in the study. He sincerely thanks Prof. Azmi Muhammad Samil, Dr. Azma bin Adil Elias Azmi, Dr. Muhammad Hanif bin Azmi, and also to those whom offered invaluable assistance during our research project. Thank you.